Have you ever stopped to really think about what a single glass of baking soda water could be doing to your body? Because here's the shocking truth: in just 3 minutes after drinking it, your blood's pH level can begin to shift. And studies from top U.S. medical journals suggest that sodium bicarbonate may help neutralize acid overload in patients with chronic kidney disease, a discovery that's changing how some doctors view this humble kitchen powder. Yet, while some people swear by this ancient remedy, others have never heard of its true potential. Why does something so simple, so affordable, and sitting quietly in your pantry hold such untapped power, from improving digestion and reducing muscle fatigue to possibly easing inflammation? This overlooked compound could be the secret weapon hiding in plain sight. But here's the catch: used the wrong way, it could lead to side effects that no one talks about. So is baking soda water a miracle elixir or a hidden danger? In this video, we're diving into 12 science-backed health benefits of drinking baking soda water, many of which are rarely discussed. I'll also walk you through the correct way to mix it and the critical precautions you need to know before trying it yourself. Trust me, you do not want to miss this, because the line between healing and harm might be just 1 teaspoon wide. Before we jump in, don't forget to like, share, and subscribe to Senior Life so you never miss out on powerful health insights just like this one. And now let's move on to the 12 main benefits of drinking baking soda water. Let's begin with Benefit 1: Rapid relief from heartburn and acid reflux. Let's talk about one of the most uncomfortable problems. Many older adults silently suffer from heartburn and acid reflux. According to a study published in the American Journal of Gerontology, over 60% of adults over age 60 report experiencing reflux symptoms at least once a week. And the older we get, the more likely it is that our lower esophageal sphincter, that muscular valve between the stomach and esophagus, weakens, making it easier for stomach acid to flow back up. As a practicing physician who's treated aging patients for decades, and as someone now in his late 60s, I felt that burning sensation in my chest after a late dinner or a spicy lunch. I know firsthand how disruptive it can be. Here's the fascinating part: sodium bicarbonate, or baking soda, is an alkaline compound that helps quickly neutralize excess stomach acid. The Cleveland Clinic and NIH both note that when used in small amounts, it can provide rapid relief, often in under 10 minutes. Let me give you a personal example. Last Thanksgiving, I overdid it on the stuffing and cranberry sauce. Big mistake. Within half an hour, I had that familiar tightness in my chest. I mixed half a teaspoon of baking soda in 4 ounces of water, sipped slowly. And within minutes, the discomfort eased. It was like turning off a fire. Of course, this isn't a long-term cure, and it's not for everyone. People with high blood pressure or kidney issues should be cautious, since baking soda contains sodium. Here are a few warning signs that your heartburn may need more than home remedies: a burning sensation behind your breastbone more than twice a week, sour taste in your mouth especially at night, chronic cough or hoarseness. If you notice these, it's time to talk to your doctor. Benefit 2: supports kidney function. Especially in chronic kidney disease, let's shift our focus to something many older adults are quietly struggling with: kidney health. More specifically, chronic kidney disease, or CKD. According to the Centers for Disease Control and Prevention, over 37 million adults in the U.S. have CKD, yet most don't even know they have it. And among seniors, especially those over 65, the risk is dramatically higher due to age-related decline in kidney filtration rate, also called eGFR. Now here's where it gets interesting. Studies from journals like the Clinical Journal of the American Society of Nephrology have shown that oral sodium bicarbonate, Yes, the same baking soda in your kitchen may help slow the progression of CKD in some patients. How? By neutralizing excess acid in the blood, a condition called metabolic acidosis, which is common in kidney disease. When the kidneys can't excrete enough acid, it builds up and can silently damage muscles, bones, and even worsen kidney function. Baking soda helps buffer that acid and reduce that risk. I remember one of my patients, James, a retired math teacher from Ohio, 74 years old, came in with fatigue, muscle weakness, and lab results that showed his blood bicarbonate levels were low. After consulting his nephrologist, we started him on a low-dose baking soda regimen. Within a few months, not only did his energy improve, but his kidney function decline also stabilized. Of course, this is not a DIY solution. Too much baking soda can lead to high sodium levels, increased blood pressure, and even heart issues if not monitored. It's essential to talk with a doctor and get routine lab work. Some signs your kidneys might be struggling include swelling in your ankles or feet, feeling tired for no reason, muscle cramps especially at night, trouble concentrating, frequent urination especially at night. If you notice these, don't ignore them. Early support makes a huge difference. Benefit 3. Reduces gout symptoms by lowering uric acid levels. Let's talk about something that hits a little too close to home for many of us over 60 gout. That sharp stabbing pain in the joint, usually the big toe that wakes you up in the middle of the night, like a lightning bolt. Now, from a medical standpoint, gout is caused by excess uric acid in the blood, which crystallizes and settles into joints. According to the National Institute of Arthritis and Musculoskeletal and Skin Diseases, the prevalence of gout is highest among men over 65 and postmenopausal women due to reduced kidney function and hormonal changes affecting uric acid clearance. And here's what many people don't know. Sodium bicarbonate baking soda may actually help neutralize uric acid levels. A study published in Rheumatology International found that alkalizing the body-raising blood pH can help increase the solubility of uric acid, making it easier for the kidneys to flush it out. From a clinical angle, this makes sense. As we age, our renal excretion rate decreases. That means your kidneys have a harder time filtering out uric acid. So if you're older and eating purine-rich foods like red meat, organ meats, or even certain seafood, you're stacking the deck against your joints. Now, this isn't a miracle fix. It's not a replacement for prescription medication like allopurinol or colchicine. But for mild occasional flares and always under medical guidance, baking soda may help support a more alkaline internal environment, which discourages crystal formation. Some common warning signs of rising uric acid levels include sudden intense joint pain, often at night, swelling and redness around a single joint, a burning sensation even with light touch, stiffness or a gritty feeling in the joint after walking. If you're seeing these, don't ignore them. Gout can lead to permanent joint damage if left untreated. Benefit 4. Balances the body's overall pH, reduces the risk of acidosis. As we age, one critical factor that often flies under the radar is our body's acid-base balance, specifically maintaining a healthy pH level. When that balance tips too far toward acidity, a condition called low-grade metabolic acidosis can silently take hold. According to a 2015 review in the American Journal of Clinical Nutrition, even mild chronic acidosis is linked to muscle-wasting bone loss and reduced kidney function, especially in people over 60. The kidneys naturally lose their acid buffering efficiency with age, making it harder for older adults to eliminate acid from the body. The science is clear: when your blood becomes too acidic, say from a diet heavy in processed foods, meats, or soda, the body pulls calcium from your bones to neutralize it. Over time, This accelerates osteoporosis, frailty, and muscle decline, all of which are devastating in our later years. It's not about aiming for extreme alkalinity, it's about balance. The body thrives when blood pH is slightly alkaline, around 7.35 to 7.45. Outside that range, systems start to struggle. Muscles become weaker. Bones begin to lose density. Kidneys become less efficient. Even cognitive clarity can fade with prolonged acidosis. So how do you know if you might be on the acidic side? Watch out for these subtle signs. Persistent fatigue. Muscle cramps, especially in the calves. Shortness of breath with mild exertion. Confusion or foggy thinking. Frequent urination, or a sour taste in the mouth. If these sound familiar, it's worth checking in with your doctor and running a serum bicarbonate or blood gas test. Benefit 5. Helps improve urinary tract infections. UTIs. Urinary tract infections, or UTIs, are more than just a nuisance for older adults. According to the National Institute on Aging, they're among the most common infections in people over 65, especially in women. As we age, bladder function weakens, estrogen levels drop, and the immune system becomes less responsive, making it easier for bacteria like E. coli to thrive in the urinary tract. What many people don't realize is that urine acidity plays a huge role. Bacteria prefer an acidic environment. But when we raise the pH of the urine slightly, making it more alkaline, it can make it harder for bacteria to survive. Some research published in Urology Journal suggests that substances like sodium bicarbonate, when taken in small, safe amounts, can help relieve symptoms by reducing irritation and burning, and may support the effectiveness of antibiotics in early stages. Some common signs of a UTI in older adults include a frequent urge to urinate even when little comes out, burning or discomfort when urinating, cloudy or foul-smelling urine, mild fever or chills, and sometimes confusion, especially in older adults, where UTI symptoms can appear more subtly. My best advice: hydration is key. Water helps flush bacteria out of your system, and if your doctor approves alkalizing agents like baking soda, may offer additional comfort during treatment. Now I'd love to hear from you. Have you or someone in your family had frequent UTIs? Benefit 6. Boosts athletic performance by reducing lactic acid buildup. One of the lesser-known barriers to exercise performance, especially in older adults, is the buildup of lactic acid in the muscles. During physical activity, particularly resistance training or brisk walking, the body shifts from aerobic to anaerobic metabolism, producing lactic acid as a byproduct. Now, when too much of it accumulates, it causes that familiar burning sensation, muscle fatigue, and early exhaustion. A study published in the Journal of Applied Physiology showed that as we age, our mitochondrial efficiency decreases, making us less effective at clearing lactic acid. This means older adults often hit their fatigue threshold faster than younger folks. But here's the good news. Research from Sports Medicine and the American College of Sports Medicine indicates that alkalizing agents like sodium bicarbonate can help buffer lactic acid, increasing time to exhaustion and reducing soreness post-workout. I remember one patient, Michael, 72, a retired firefighter who came to me frustrated. He was trying to stay active walking hills and using light weights, but his legs would burn out after just 10 minutes. After reviewing his labs and ensuring no cardiac issues, we introduced a mild dose of baking soda water 30 minutes before activity under supervision. The result, Michael reported lasting longer during exercise and recovering more comfortably the next day. Of course, this isn't a universal solution. Too much sodium can affect blood pressure, and it's not suitable for everyone. But in carefully guided situations, it can extend endurance and reduce that lactic burn, especially important for seniors trying to maintain mobility balance and muscle mass. Some signs you might be experiencing excessive lactic buildup include burning or stiffness in the legs even during mild activity, muscle soreness lasting longer than 48 hours, unusual fatigue right after brief exertion, tightness or cramping in the calves or thighs. Let's move on to benefit 7, helps reduce bad breath by balancing pH levels in the mouth. Chronic bad breath, also known as halitosis, is more than just a social nuisance. For many seniors, it's a sign of underlying oral imbalance, particularly related to low pH in the mouth. As we age, saliva production declines, medications can dry out the mouth, and poor oral pH allows odor-causing bacteria to thrive. According to research published in the Journal of Breath Research, the ideal salivary pH should hover around 6.8 to 7.4. When it drops below that, acid-loving bacteria like Prevotella and Fusobacterium become dominant, producing volatile sulfur compounds, VSCs, which are the main cause of that rotten egg smell. I've had several patients over 65 come in embarrassed by persistent bad breath, despite brushing and flossing regularly. One of them, Margaret, 71, told me she had stopped attending her weekly book club because of it. Her oral exam looked clean, but her salivary pH tested low. We introduced a simple rinse, a small amount of baking soda dissolved in warm water twice a day. Within 2 weeks, she reported fresher breath and regained her confidence in social settings. The science makes sense. Baking soda is mildly alkaline. It helps neutralize mouth acidity, create an environment less favorable for sulfur-producing bacteria, and even reduce plaque buildup. It's gentle on older enamel, unlike some mouthwashes that contain alcohol or strong chemicals, which may worsen dry mouth. Some signs that your oral pH might be too acidic include persistent bad breath despite brushing, sour taste in the mouth, especially in the morning, dry mouth or thick, sticky saliva, frequent cavities, or increased tooth sensitivity. Now it's time for Benefit 8, relieves muscle soreness after exercise. Muscle soreness after exercise, what we call DOMS, or delayed onset muscle soreness, is something I hear about almost daily from my older patients. It's that deep, achy feeling that kicks in 24 to 72 hours after a workout, especially if you've done something new or more intense. According to a study published in the Journal of Aging and Physical Activity, aging muscles experience greater inflammation and slower repair, which is why people over 60 often feel soreness more intensely and for longer periods than younger folks. One of my patients, Don, 70, recently started strength training at his local gym. He was motivated and committed, but after his second session, he could barely lift his arms for 3 days. We added a simple baking soda solution to his post-workout routine, a small dose mixed in water, and within a week he noticed a big difference in how fast he recovered. Scientific reviews, including one in Frontiers in Physiology, show that alkalizing agents like sodium bicarbonate may help buffer lactic acid, reduce muscle inflammation, and speed up recovery by improving cellular pH balance. Of course, I always tell my patients, start slow, hydrate well, and listen to your body. Seniors especially need gentle stretching, adequate protein intake, and tools like cold therapy or magnesium baths to support recovery. But baking soda used correctly can be a surprisingly helpful addition. You may be dealing with excess soreness if you notice sharp or deep aching muscles 48+ hours post-exercise, reduced range of motion or stiffness, discomfort when going downstairs or standing from a chair, muscle tenderness to the touch. Now let me ask, what recovery methods have worked best for you? Benefit 9. Potential support in cancer therapy. Currently under research. Emerging research has raised an intriguing possibility that sodium bicarbonate may support certain cancer therapies, especially by modifying the acidic environment that tumors often thrive in. According to a study published in Cancer Research, tumor tissues, particularly in aggressive cancers, tend to become highly acidic due to altered metabolism. This acidic microenvironment can inhibit immune cell activity, promote tumor spread, and reduce the effectiveness of chemotherapy. Now, this is still in the research phase. No one's calling baking soda a cure. But what's fascinating is that in mouse models, oral bicarbonate was shown to raise the pH of tumors, making them more responsive to treatment. The University of Arizona and MD Anderson Cancer Center have both explored this concept, and early results suggest that altering tumor acidity could enhance T-cell infiltration and drug delivery. I had a patient, Harold 76, who was going through chemotherapy for prostate cancer. We didn't change his treatment plan, but with the oncologist's approval, he adopted a low-dose alkalizing support routine. It included dietary shifts and a carefully measured baking soda drink a few times a week. While we can't prove causality, he tolerated his chemo cycles better than expected, with less fatigue and improved appetite. Of course, this kind of strategy isn't for everyone and should never replace conventional treatment. Seniors in particular must be cautious with sodium intake due to risks of hypertension and fluid retention. Signs that the tumor environment may be highly acidic or that inflammation is rising can include persistent fatigue despite rest, unexplained weight loss, chronic low-grade pain, nausea or poor appetite during treatment. Benefit 10 acts as an antacid, relieves indigestion. Indigestion, also known as dyspepsia, is one of the most common complaints I hear from older adults. Bloating, burning heaviness after meals. It can really affect quality of life. As we age, our stomach acid levels can become erratic, either too high or too low, and the lower esophageal sphincter weakens, increasing the likelihood of acid reflux. According to a review in the American Journal of Gerontology, over 40% of people over age 65 report frequent digestive discomfort, often managed with over-the-counter antacids. What many people don't realize is that sodium bicarbonate, or baking soda, is a natural antacid. It works by quickly neutralizing stomach acid, offering fast relief. A clinical overview published by Cleveland Clinic even notes that small diluted doses of baking soda can temporarily ease symptoms of indigestion, especially when taken 20 to 30 minutes after meals. But of course, I always remind my patients, this is not a long-term solution. Seniors must be cautious with sodium intake, especially those with high blood pressure or kidney issues. If symptoms persist, deeper causes, like H. pylori infection or bile reflux, need to be ruled out. Here are a few signs your indigestion might need support. Burning sensation in your chest or upper stomach after eating. Feeling uncomfortably full even after small meals. Burping, bloating, or sour taste in the mouth. Nighttime discomfort that disrupts sleep. Benefit 11 soothes. Sore throat, canker. Sores and minor mouth ulcers. Sore throats, canker sores, and minor mouth ulcers may seem harmless, but for older adults, they can seriously affect quality of life, making it hard to eat, speak, or even sleep comfortably. With age, oral tissues become thinner and the immune response slows, which means even small ulcers take longer to heal. According to a study in the Journal of Oral Pathology and Medicine, adults over 65 are more likely to experience recurrent aphthous ulcers and dry mucosa, both of which can be aggravated by acidic foods or oral bacteria. What's interesting is that a baking soda rinse, just a half teaspoon dissolved in a cup of warm water, can help neutralize acidity, reduce irritation, and promote faster healing. It creates a more alkaline environment in the mouth, making it harder for bacteria and fungi to thrive. In fact, Cleveland Clinic recommends baking soda rinses as part of supportive care for cancer patients with oral mucositis, due to its gentle, non-irritating nature. I remember my patient Robert, age 74, came in complaining of a painful sore under his tongue that hadn't healed for over a week. He wasn't eating well and was worried it might be something serious. After ruling out infection or malignancy, we added a baking soda rinse to his daily routine twice a day after meals. Within days, the inflammation reduced and his appetite returned. If you're noticing any of these symptoms, it might be time to support your oral tissue, painful or burning spots inside the mouth, difficulty chewing or swallowing, tiny white or red ulcers that don't heal within a week, bad breath or dry, sticky feeling in the mouth. And benefit 12, relieves itching, burning, and skin irritation. When used topically. Soaking, rinsing. Skin irritation in older adults isn't just uncomfortable, it's often chronic and can lead to infection if not managed properly. With aging, the skin barrier becomes thinner, natural oils decline, and the ability to recover from minor irritants slows down. According to a study in the Journal of Dermatological Treatment, nearly 50% of adults over 65 report frequent itching or burning sensations often related to conditions like dry skin, xerosis, eczema, or even mild fungal overgrowth. What's interesting is that baking soda, when used as a topical soak or gentle rinse, may help soothe inflammation. It acts as a mild alkaline buffer, which can neutralize acidity on the skin's surface and reduce itching signals. In fact, Mayo Clinic lists baking soda baths among recommended home remedies for conditions like poison ivy, sunburn, and contact dermatitis, thanks to its calming effect on irritated nerve endings. If you're experiencing any of the following, it may be time to treat your skin gently persistent, itching without a visible rash, burning or tingling after contact with soaps or detergents, red or flaky patches that worsen in dry air, skin sensitivity that seems new or unexplained. Baking soda, a simple white powder, can actually offer 12 surprising health benefits for seniors, from relieving muscle soreness and neutralizing stomach acid to soothing skin, irritation, easing mouth ulcers, and even showing potential in early-stage cancer support. However, always consult your doctor before using it, especially if you have conditions like high blood pressure or kidney disease. When used correctly, baking soda can be a simple, affordable, and effective tool in your wellness routine after 60. Don't forget to share your experience in the comments and like, share, and subscribe to Senior Life to keep discovering new ways to stay healthy every week.